sure we'll both have enough time. Thanks a lot. We welcome the bill and its key provisions. The provisions to support and increase organ donation and transplants through a soft opt-out system of consent are welcome and should ensure that many more organs become available for transplant. That is obviously very good news for the over 500 people in Ireland who are on waiting lists for organ donation. In 2021, there were 203 organ donations from 99 donors. About 250 organ transplants took place in 2022 from 119 donors. And the 2022 figure includes kidney transplants from 33 living donors. The Chief Executive of Cystic Fibrosis Ireland has said, quote, "Transplant and donor rates in Ireland have the significant potential to be improved by this legislation, if accompanied by the necessary resources and public awareness supports," end quote. So I think it's vital that we do ensure that the resources, public awareness campaigns and so on follow on from the legislation. And the truth is that this legislation is long overdue. We are the last country in Europe to introduce a soft opt-out. A soft opt-out system of consent for organ donation was introduced in Wales in 2015. Within 4 years, the rate of people donating increased from 58% to 77%. England introduced an opt-out system in 2020, Scotland in 2021, and we hope that one will soon be in place in the north. The Council of Europe Transplant Report of 2021 showed Ireland with transplants per million population at 40.6. That's well below the rates achieved in countries like Spain, which is very close to 100, or the UK, very close to 60, or Croatia, with a similar size population at 65.4 transplants per million population. It is the international norm to have legislation governing donation, organ donation and transplantation, and the bill introduces Ireland's first legislative framework in this area. So at last, Ireland will be brought into line with good international practice in relation to governance of practices relating to human tissue. It's clear that the bill is long overdue. A key issue for organ transplants now will be specialist transplant capacity. The Irish Kidney Association recently commented that the increase in donors and transplants in 2022 is welcome, but, quote, "the underpinning infrastructure is still fragile." For example, the November 2021 incident wherein organ donation was not used due to a lack of resources. We await the recommendations of the investigation into this incident, end quote. In November 2021, an organ transplant operation at the Mater Hospital was cancelled because of shortage of ICU beds. The organs became available, they were delivered to the Mater Hospital by ambulance. The transplant patient was put on standby and the procedure was due to go ahead later that day. But the hospital's ICU beds were full, and despite a frantic check of other hospitals in Dublin, no ICU beds were available and the operation had to be cancelled. The Irish Kidney Association has also said recently, quote, "It is disappointing to see that the levels of heart and lung transplants have not recovered to pre-COVID-19 activity levels, and it will be interesting to understand the reasons for this." The Irish Kidney Association has also called for more transparency around transplant waiting lists. They said, "We need more clarity about the reasons why more transplant operations are not taking place in Ireland." In the UK, a detailed report is available on each step of the process that results in organ donation and transplantation. No such data is published in Ireland. The Irish Kidney Association correctly also wants more transparency on the criteria for patients to be accepted or removed from transplant waiting lists for heart, lung, liver, kidney and pancreas. For example, there are over 2,000 patients with end-stage kidney disease receiving dialysis treatment in Ireland, but 20% of these patients are on the transplant waiting list. We need more transparency in all of these issues. Our ICU bed capacity is far below what we need and far below the EU average of ICU beds per capita. We need to almost double the number of beds in the public health system. There's currently about 300 ICU beds available in our hospitals. This needs to be increased to about 600 beds to ensure that we have the capacity needed. The government and previous governments have failed to act on this deep lack of ICU bed capacity. The likely increase in organs available for transplants makes this even more urgent. We have a chronically underfunded public health service, whether it's A&E departments, CAMS, bed capacity. Lack of capacity in staff undermines the health service, leaves more than 1 in 5 of the population on some form of health waiting lists, and creates entirely unavoidable risks to the health of so many for want of timely care. I want to also take this opportunity to raise the case of Daithí McGowan, a 5-year-old boy from West Belfast. Daithí McGowan was born with hypoplastic left heart syndrome, and he has been waiting for a heart transplant for most of his life. He's also inspired a truly remarkable campaign. His parents, Martine and Seth, have done Trojan work on opt-out organ donation. They've raised awareness, broken down concerns, and galvanised an entire community. Indeed, the Donate for Daithí campaign was so successful that it succeeded in achieving that most unique of things, cross-party support in Stormont for opt-out legislation. That law has been named Daithí's Law. Stormont has passed the legislation, but the full implementation is being held up because there is no functioning executive. The family have fought enough. They've been banging on the door of the Secretary of State to demand he intervenes. They've secured a meeting with him on the 1st of February. The demand from the campaign is clear. The demand from Martine and Seth is clear. The demand from Daithí Og is clear, that the Secretary of State step in and enact the necessary legislation to ensure Daithí's Law becomes a reality. I would ask our Minister to intervene, to write to the Secretary of State before February the 1st, to press Chris Heaton-Harris to hear Daithí's call. Thank you.